Medical experts in the field of oncology joined the BVI Medical and Dental Council and the BVI Medical Association for an Oncology Symposium on January 23rd at Fort Burt Hotel. The second annual symposium was held under the theme Patient-Centered Care, It Takes a Team, with emphasis on cancers, general surgery, and radiology services. Dr. Craig Stout, anesthesiologist, board member of the BVI Medical and Dental Council, and the vice president of the BVI Medical Association, pointed out that the medical field is very dynamic and highlighted the value of continued education for improved standards in healthcare delivery.
The medical field on a whole is very dynamic. It's constantly changing, constantly evolving, so you always have to be at your best. And this itself makes our field very exciting. So continuing education is a must, and it helps to keep us relevant. It's important for our personal development, but most important of all, it's important that we give the best possible care to the persons that we are serving.
Over 50 members of the BVI's medical and nursing societies attended the Oncology Symposium, organized by Dr. Mitchell Penn, with assistance from South Florida sponsors, Impression Imaging in Tamarack, 21st Century Oncology in Pembroke Pines, and our NOAA Patient Navigators in Fort Lauderdale. The symposium was addressed by Dr. Michael Fagan, nuclear radiologist, Dr. Eduardo Fernandez, radiation oncologist, and Dr. Mary Beth Tomaselli, who shared her own experience with breast cancer while underscoring the effects of negative emotional impact of delaying diagnosis and treatment. The Harvard-trained breast surgeon spoke on the latest diagnostic tools available for early detection of breast cancer.
As recently as last month at the San Antonio Breast Symposium, they re-examined 4 large studies of screening mammograms from Norway, the United States, the United Kingdom, and the European network. They standardized the patients for age, target population, and follow-up, and all 4 studies indicated a substantial reduction in breast cancer mortality with regular breast cancer screening. The big disagreement in whether or not it's efficacious to be doing screening in mammograms is overdiagnosis. But the risk of overdiagnosis appeared to be outweighed by the mortality benefit. Now, overdiagnosis is now partially dealt with by the 3D mammogram. When a radiologist looks at a film and thinks they see something on the mammogram, the patient is called back for either additional pictures in diagnostic mammograms or breast ultrasound, breast MRI, biopsy. All of those things add to the anxiety of the patient and certainly the cost of the care. So anything that we can do to streamline that is beneficial both in terms of the patient and in terms of cost. And it was from this controversy that 3D mammogram was born. On the right, you can see the corresponding tomogram of the same patient, and there's absolutely nothing there. That was all superimposed breast tissue that appeared that way on a 2-dimensional mammogram. So there will be fewer recalls because there'll be fewer patients called back for things that really aren't important.
The symposium highlighted how the team of physicians from the BVI and South Florida worked together to ensure that patients have access to the latest and most advanced cancer care. Dr. Craig Stout says similar presentations will be held in 2014. The visiting doctors also toured the New People's Hospital. After the tour, Dr. Fernandez said, quote, "We know of no other Caribbean island that has such an impressive medical facility as this, and wishes people's continued success in their quest to bring state-of-the-art medicine to the BVI," end quote. Dr. Fernandez and Dr. Vanderpool recently developed a brachytherapy program for treating prostate cancer at Bougainvillea Clinic. This will be the first of its kind in the BVI, and Bougainvillea Clinic is expected to offer the service in the near future for patients in need of prostate cancer treatment.